Hi everyone, Elizabeth here at VSoft. Today we are doing a vector lift on my beautiful patient here. We are going to be doing a little bit of cheek filler as well as chin in about 3 weeks. So we wanted to do a little lift beforehand. I always lift and then fill. This patient is, very young. She doesn't need anything dramatic, but she was just wanting to focus mostly on that cheek and just pop out that cheek a little bit, that fat pad. She's starting to see just a little bit of descent there, so she wanted, again, just a very small lift. But we're going in with 3 threads, 2 to her nasolabial fold and 1 down to her jawline, and then 1 going horizontal with her jawline as well. So I am starting off with my lidocaine. This is Lido with Epi. I use this in every single video. It just helps with bleeding. I did have an assistant today, which was nice. I don't always, but if you don't have an assistant helping you out with this treatment, I do recommend using that Epi. It just helps control bleeding a little bit more. But I'm just going in with my pilot hole. This is an 18 gauge. I'm going to be using 18 gauge threads, so I just want to make sure that my entry point is large enough. I personally like to pre-tunnel with a cannula and place my anesthetic this way. Some providers prefer to do just blebs of lidocaine at the top of the vector and at the bottom. That's totally fine too. It's just a provider preference. But if I am going in with a larger gauge cannula, I do prefer to pre-tunnel. I find that it's easier to navigate through the tissue, especially on someone like her. She's very young. She has great collagen and elastin still. So sometimes it is a bit difficult to push through that plane. So just depending on the patient. As you can see, I'm just giving it a little oomph if I get caught up on a ligament and just going ahead and placing a little bit of anesthetic. I believe I have 1%. You can use 1%, 2%. I do mix a little bit of sodium bicarb just to help with the sting, but just a splash as long as my patient is comfortable. And as you can see, she can barely feel what I'm doing here. So now I'm going in with an 18 gauge lifting thread. This is an Arte 1 18. I prefer the Arte 1s over the 2s. It's just, again, provider preference. You just have to find what works best for you. But I just like to use my left hand as my smart hand and make sure that I see that thread engaging as I pull out. And these are 100 millimeter threads, so I do have some, hanging out at the end, but that's okay. Of course, we're going to go ahead and cut those here in a minute. And going in with my second. Again, I am just using my left hand as my smart hand as I go down and just palpate where I'm at. I always want to make sure I can feel the end of my cannula and I'm maintaining that same plane all the way down. This is what's going to help avoid any sort of puckering or thread visibility, is ensuring that you're at a good depth. I believe I do go ahead here and cut these threads. As you can see, look at her nasolabial fold. I mean, it lifted up immediately. It looks beautiful. Overall, she got a really great result. Sometimes I clip my threads before I do my lower vector. Sometimes I don't. It just kind of depends how the treatment's going and how I'm feeling. But I kind of felt like those were going to be in the way a little bit. So I just went ahead and cut them. And I had an assistant in the room this time as well, which is really nice. Because I don't usually, but this is one of my coworkers and she was free, so she's like, oh, I'll be able to hand you stuff, which is nice. But now I'm going down and treating just a jowl thread, but again, this patient does not have a jowl. We're just aiming for that area where it would occur in the future. And as I was going down, I felt like I got a little bit superficial, so I just threw a 3cc syringe and locked in my thread there so I could back up a bit. Whenever I see something that just somewhat concerns me about thread visibility, I just go ahead and correct it right then, because that thread is going to stick around for 4 to 6 weeks, and I would rather just take the extra time to back out and make sure I like my depth than have a complication. So just make sure you're taking your time and you're always feeling and palpating. As you can see now, I have a very nice and even depth. And just following that thread up with a pull. I do believe I go back in on this side and add a marionette thread, just right down to the corner of her mouth, because once I sat her up, I just felt like she needed one more. And I do recommend doing that. just because what the patient looks like when they're laying down versus when they're sitting up and you see gravity affecting it can change it. So I went ahead and did this jawline, but like I said, I do believe I went back and did a marionette. But just, piece of advice, sit your patient up when you're done, view your results, and if you need to add more, go ahead and do so. I just find it better to go ahead and have the patient go through the healing process once. Of course, if they came back in 3 weeks and they needed something, I would go ahead and correct then. But if I sit them up and I see it, I would rather do it then and give them the best result possible. And just be careful with the hair. As we can see, I had them put a piece of gauze over her hair just because I felt like my cannula was going to touch there. So this is not a sterile procedure, but it should be as clean as possible to avoid infection. I have not had a thread infection in the past 3 years that I've been treating with threads, but it is a possibility. So just make sure that you are being as careful as possible. So I'm going just right for that little pocket of heavy tissue right by the corner of her mouth, just to kind of snatch her jawline back. And just pulling that tissue over that thread and giving it a little bit of a reverse pull, and you can see that tissue pick up right away. And snipping my end. And I do believe, like I said, I go in and I do a marionette thread. You can kind of see how I was pulling there, and yep, here it is. I decided they did not include sitting her up, but we will see her at the end, hopefully. There's just a little, I just felt like we could do a little enhancement there. So we're just doing one more. Same technique. I'm pre-tunneling with my cannula. This is a 2275. And just putting a little splash of lidocaine. As you can see, she's very comfortable. So as long as your patient's comfortable, you are good to go. But again, I'm going just right for that little pocket that I was noticing. A little cheek filler is going to help with that as well and bring the eye upwards. But while we had her in the chair, I went ahead and just added that extra thread. This is a VSoft 19 gauge. So I did go down a gauge for this vector. I was kind of using a mixture of both throughout, but this is a 19 RT1 and it's 100 millimeters as well. So I'm ending just right in that small pocket there and just going to go ahead and pull that tissue up and over as I pull out, and we'll add her band-aid back here and she will be good to go, and we'll see her back in about 3 weeks because we are going to be doing filler, so I just want to make sure she is completely healed. And I do believe we show her sitting up here in a second, but I just go ahead and throw on my band-aid. You can see she has a small pucker there, which I'm just going to go ahead and smooth over, and it should just pop out.